What we're going to do here now is we're going to do what's called a sacroiliac joint injection. Sacroiliac joint injections are designed for people who have what is called sacroiliitis. The sacroiliac joint is a joint that connects your sacrum, which is the very base of your spine, many people call it your tailbone, to the rest of your pelvis. That is your iliac bones. This joint is a very frequent cause of pain in people and is often mistaken for other causes of low back pain, such as herniated disc or degenerative discs. What we do in this injection is we put steroids into the joint with the idea of blocking the inflammation in the joint. Inflammation is the root of all pain, and so by blocking inflammation, that tends to take away the pain. It also is diagnostic. That is, if the injections work, even for a short period of time, it tells us where the pain is coming from. This part of your spine is very crowded with a lot of nerves, with your hip joint, with your sacroiliac joint, with your pelvis, and with all of the bones in your spine. So it's important to try and figure out exactly where the pain is coming from, and this injection often helps to do that. So what we do first in the injection is we have this patient asleep. We do many of our injections under anesthesia, where we have a certified registered nurse anesthetist in the office to monitor and to help out by keeping patients asleep. The medicine that we give is called propofol. It makes people go to sleep and they don't remember anything that's going on with the procedure, which most people like. This is also good for dental procedures. This medicine sets up very quickly, usually in about 10 to 20 seconds. So we're going to go ahead and put the needle in to do the actual injection. Spot. And you can see on the screen here that we guide all of these injections with fluoroscopy. Fluoroscopy is real-time injection spot monitoring. That is, we can see exactly where we're putting our needle so that we know we're putting exactly the right place. So you can see the sacroiliac joint is right here. We put this needle in the base of the sacroiliac joint, and we are going to put a little contrast in there to make sure we're in the exact right spot. And so we can see the contrast rising up in the joint. It's fairly faint. And now we're going to put the steroid medicine in. The steroid medicine has a little local anesthetic in it. The local anesthetic helps with the pain. The steroid medicine helps with the actual problem. So we're injecting it in, and we're done. So that is a sacroiliac joint injection. After the procedure, we'll wake the patient up. We will let her recover for about 10 to 20 minutes. Once she recovers from the anesthesia, she'll go home. Pretty much everybody needs to have a driver when they get injections like this. Because of the use of the conscious sedation, we want them to have somebody to drive them home. You can't drive after this.